Dear colleagues, nature is perfect, and here I am striving to do a perfect PHACO surgery. This is the main incision and the posterior aspect of the limbus. Includes some blood vessels and let some blood ooze out. We can see there is pseudoexfoliation in this case. This is a paracentesis on the right side of the main incision about 3 clock hours away, and this is another paracentesis about 2.5 clock hours away from the main incision on the left side. This is an air bubble. I want to stain the anterior capsule with trypan blue dye so that I can do rhexis very easily. And in this case, I'm using it to see how the pseudoexfoliation material and how the capsule behaves to trypan blue dye. This is a bit of adrenaline. We know that in pseudoexfoliation the pupil doesn't dilate well, and there is a high propensity to develop open angle glaucoma. And now the dye is washed out, and we can see that the capsule has stained more than the pseudoexfoliation material in the periphery. And now this is 2% hydroxypropyl methyl cellulose filling up the anterior chamber. Capsulorhexis is to be done. I incise the capsule with a 26 gauge pen needle, raise a nice big easy to hold flap. Now I use the Utrata forceps, very slender, very handy Utrata forceps. Go anti-clockwise, remain very close to the margin of the pupil because the pupil has dilated, say up to 7 millimeter, and complete the rhexis. This is a fairly acceptable continuous curvilinear capsulorhexis. Hydrodissection is done, the nucleus is mobilized, and the nucleus is rotated. Visco is again injected, and now is the time to introduce the tip of the PHACO handpiece. Here it goes. This is Oatley Catarix 3 PHACO machine. Bevel down, and the tip goes into the anterior chamber. Remove some superficial cortical matter, and the surface of the nucleus is exposed. And now this is direct chop. Bury the tip into the substance of the nucleus and chop it. Don't bother whether it is vertical chop or horizontal chop. Just divide the nucleus into pieces, emulsify and remove. That's it. And now see, this piece which is sticking to the corneal endothelium is being dislodged by the fluid jet, and it comes to the tip. Now I come out, inject some viscoelastic substance, and now cortical cleanup is to be done. Dear colleagues, this is a totally unedited PHACO surgery, and I believe that you can follow better if the surgery is unedited. In this case, I am going to use bimanual irrigation aspiration for cortical cleanup. Here it is. The irrigation is from the right side and the aspiration from the left side. I have started from 9 o'clock. Now at 10 o'clock. Now at 11 o'clock and 12 o'clock. And then 4 o'clock. Here it is. I have caught the iris at around 3 o'clock. Most of the cortex has come out. Only the sharp paracentesis cortex at 2 o'clock is there, and here it is removed, and within few seconds the cortex is nicely clean. Now this is what I call hydro polish, using the fluid jet to polish the posterior capsule. It is very safe. PC rent never occurs if you use fluid jet for polishing. And here it is. This is a hydrophobic acrylic intraocular lens being implanted under irrigation. It's a single piece lens, and here the trailing haptic is placed in the capsular bag just by a simple maneuver of the left hand instrument. Yes, the haptics are about 90 degrees away from the main incision, and now this is a bit of moxifloxacin. Now the side ports are closed by hydrating the stroma on either side of the paracentesis openings. And that's it. And now this is the final lavage of the anterior chamber. I take fresh BSS and irrigate the anterior chamber, or sometime some viscoelastic substance that sticks to the corneal endothelium comes out, and thorough cleaning of the anterior chamber is done because there was some viscoelastic substance in the lumen of the cortex. Now the anterior chamber is formed, and we have something else to see. We have to see if there is any leakage from any site. I use a cotton tipped Johnson bar to check. Yes, there is no leakage. And now a few drops of moxifloxacin is applied over the ocular surface, and the case is concluded. Thank you very much for watching. Hope this video will help you to develop your surgical skills. Strive to be perfect.